Hey there. How can I help you today?
Hey, I need help regarding a couple of terms. I just completed my basic training for healthcare, and I'm kind of catching up on a couple of terminologies. Can you tell me what's the difference between copay and deductibles, please?
Oh, wow. Catching up on healthcare terms, huh? Sure, I can help with that. So, a copay is a fixed dollar amount you pay upfront each time you receive covered healthcare services. This amount can vary depending on the service, like seeing your primary care provider or visiting a specialist. For example, you might have a $20 copay for a regular doctor's visit and a different amount for a specialist. On the other hand, a deductible is the set amount you pay for covered health services or drug costs before your insurance plan starts paying. This is usually an annual amount. For instance, if you have a $500 deductible, you need to pay that amount out of pocket before your insurance kicks in to cover the remaining costs for in-network services. Got it? If you need more details or have another question, just let me know.
Yes, please. So how does this connect to my eligibility? Is this an important factor regarding eligibility of my plan or of my insurance?
Interesting question. Understanding the difference between copay and deductibles is more about how you manage your healthcare expenses rather than your eligibility for an insurance plan. Your eligibility for a plan typically depends on factors like your employment status, residency, age, and sometimes your health status, but not directly on how well you understand these terms. However, knowing the difference between copay and deductibles can help you make better decisions about which plan might be more cost-effective for you based on your healthcare needs. So, while it's super important to understand these terms for managing your costs, they don't directly affect your eligibility for a plan. Anything else you need help with?
Ah, I see. Understand that now. So I believe this is more aligned with my benefit plan coverage. Can you provide me more details onto how does this apply on coverage for both scenarios?
Got it. So, you're curious about how your benefit plan coverage applies to both copay and deductible scenarios, right? Let's break it down. 1. Copay. This is a fixed amount you pay each time you receive a covered healthcare service. For example, you might pay $20 when you visit your primary care doctor. Copays can vary depending on the type of service or provider you see, and they usually don't count towards your deductible. 2. Deductible. This is the amount you need to pay out of pocket for covered services before your insurance starts to pay. For instance, if your deductible is $500, you'll need to pay that amount before your insurance covers the remaining costs for in-network services. Not all services are subject to a deductible, so it's good to check your plan details. Once you meet your deductible, your insurance plan will start paying for all or part of the remaining covered services. It's important to note that copays and deductibles are separate. Paying your copay doesn't reduce your deductible amount. If you need more specific details about your plan, like which services count towards your copay or deductible, it's best to check your plan handbook or visit your insurance portal. Anything else you want to dive into?
Nope, I am all set. Deductibles, eligibility, and benefit coverage is now clear to me. Thanks for all the information. Appreciate it.
Glad to hear that deductibles, eligibility, and benefit coverage are clear to you now. If you have any more questions in the future, feel free to reach out. Take care, buddy.
Hello, thank you for calling the payer support line. How may I assist you today?
Hello, this is Dr. Emily Carter from Springfield Endocrinology Clinic. I am calling regarding my patient, John Doe, for whom I have submitted a prior authorization request for Lantus insulin therapy. I would like to discuss the status of this request and provide any additional information needed to expedite the process.
Please provide your full name and NPI number.
Hello, this is Dr. Emily Carter, NPI, B2M7P6349.
How about patient's full name and date of birth?
Sure, the patient's name is John Doe, and his member ID is X8J29L7345. Can you check the status of the authorization request for Lantus insulin therapy?
Can you give me date of birth?
Sure. His date of birth is January 15th, 1965. Could you let me know if there are any issues with the authorization request?
Can you share diagnosis codes?
Sure. The primary diagnosis code is E11.65 for type 2 diabetes mellitus with hyperglycemia. The secondary codes are I10 for essential hypertension and E78.00 for raised LDL cholesterol. Is there anything else you need?
Is this for new therapy?
Yes, this is for initiating Lantus, a long-acting insulin therapy. Could you let me know if there are any other specific requirements for this new therapy?
Any known allergies to insulin?
Hmm, interesting. No, John doesn't have any known allergies to insulin. Is there anything else you need to proceed with the authorization?
Insulin products used in the past?
Hmm, let me think. John hasn't used any insulin products in the past. Does that affect the authorization process?
No, actually, it does not. Your request has been successfully submitted. Reference number 7639614802.
Thank you for clarifying. Could you please confirm the current status of the authorization request for Lantus insulin therapy?
It is currently submitted.
Thank you for confirming. Could you provide an estimated timeline for the approval process? Your assistance is greatly appreciated.
It will be about 48 hours.
Thank you for the information. I appreciate your help. If there are any updates or further requirements, please let me know. Have a great day.
You too. Thank you for calling. Have a great day.